Welcome back to Meds Made Easy. My name is Tarun Verma. Today we're going to talk about Lorazepam, also known as Ativan. It is a benzodiazepine. It is used generally for just anxiety, linked to depression. Off-label, it's used for a lot of different things. I won't go into it because that may be like an admission to you using it for those things, and I can't do that. That the doctor has to tell you. But things like alcohol withdrawal syndrome and things like that, it can be used for it off-label, so not FDA approved. Works on your GABA receptors. GABA receptors, what that does is by working on your GABA receptors, it decreases the neuron firing, which decreases activity in general, because again, we're trying to calm you down, okay? So we do that by kind of less neurons being fired out. So let's see here, let's go through some of it. I won't go over dosing, but it's generally a longer acting benzodiazepine, so that's why you take this versus other ones, is this one's longer acting. Generally take it 1 to 2 times a day. You can take it more if the doctor says so, but we generally don't see that in practice. It's 1 to 2 times a day. Usually you'll start to really feel the effect in about 2 hours, so it doesn't kick in right away, but it stays in your system for a pretty long time. So that's why it's kind of that, like I said, a longer acting. Let's see here. If it does go through your liver, so make sure that your doctor's aware of any other medications that you're on, because we don't want to tax your liver too much and cause problems. It does have a black box warning with other opioids, so if you've seen any of our benzodiazepine videos, you know that you should not be taking any kind of Vicodin or anything like this, any kind of opioid with this medication. It causes a lot of problems. I won't get into it because I kind of stressed on it a lot in the other videos, but do not party on this drug either. That's another big one. I can't believe I have to say that. Don't party on this drug. Drinking plus opioids plus benzodiazepines like this one cause problems. Let me give you the worst case scenario. We've seen a lot of instances where people vomit in their sleep because they drank too much or they OD'd, and then because a benzodiazepine will neutralize your gag reflex, they pretty much die from asphyxiating on their own vomit. So just don't do that. Don't party on this stuff like that, guys. And if you're taking opioids with Lorazepam at the same time, just watch out for these kinds of things, because it causes respiratory depression, meaning that it's going to kind of shut your respiratory system down. And if you take too much of it, no respiratory action at all means you're dead because you're not breathing. So watch out for those kinds of things. Pregnancy, when I was looking it up, it didn't really have a class for it, but it's teratogenic in most studies, so which means it can affect your baby. So you should not be on this medication unless there's a reason why your doctor says that you should be on it, but you really shouldn't. It is present in your breast milk, but that is safe if it's in a relative small dose. So it's called RID, relative infant dose. So as long as it's within a certain percentage, this medication is safe if it's detected in the breast milk, as long as the baby doesn't get too much. But your doctor should be testing your breast milk to make sure that you're not hitting over that amount. So just keep that in mind. Let's see here. I'm like ripping through it because I want to make sure I get everything here. Here's a list of side effects. With the medication that works in your brain, the side effects can be left, right, and everything in between. It can be all over the place. You just kind of have to see how you respond to it. It's sedating, so obviously don't take this and then go to work unless you've developed a tolerance and it works fine for you to do that. But usually I tell everyone, come home after work, try it when you're going to be home for the rest of the night, because if it makes you pass out instantly, obviously you know that you cannot be functional while on this medication. And you should only be taking it after work or at times where you're home. You don't ever want to be driving on the road and this stuff kicks in and then you do something terrible on the road. So we don't want that. Let's see here. I think that kind of does it. Obviously, when you go to get off this medication, you have to taper off, and I'll just say that very generally because the tapering cycle really depends on you, and we have to taper it to you specifically. If you've been on it for a few months, you can taper off pretty quickly. If you've been on it for a very, very long time, it takes a much longer time for you to taper off. And yeah, so I won't get into that too much. And it does have an addiction potential and dependence potential. It's a control medication, so you do have to watch out for that. Lorazepam clinically is not meant to be taken more than 4 months. So if you've been on it for more than 4 months, then there has to be a reason for it. There has to be justification why your doctor wants you on it that long. But you generally don't see this medication in practice longer than that. I mean, I still do see it, to be honest. I see a lot of people still on Lorazepam for years, and That's a different discussion to be had. Again, a very body-specific discussion to be had. But generally, you don't want to be on this for too long, because again, your body will develop a physiological dependence to it, and that's no bueno, just no bueno at all, guys. I think that's it. That covers it up. Remember, Meds Made Easy is supposed to be just giving you the who, what, when, where, and why the medication, so I hope we did that with this one. Leave comments down below. Let us know if there's any other medications you want us to do videos on. We're just trying to do good and just be as helpful as we can with these videos. Subscribe to the YouTube channel, and let us know how we're doing. We'll see you next time on Meds Made Easy, guys. Thanks. Bye.